Introduction to peptic ulcer. Peptic ulcer are painful sores in the stomach or small intestine. They are a common digestive problem that can affect anyone. This presentation will cover what causes them, common symptoms or signs, how they are diagnosed, and tips for treatment and management.
Peptic ulcers are primarily caused by Helicobacter pylori H. pylori infection and long-term use of non-steroidal anti-inflammatory drugs, smoking, alcohol, certain medication, underlying illness. Pathophysiology of peptic ulcer: number one, imbalance between aggressive factors, acid, pepsin, H. pylori acid. Defective factors are mucous bicarbonates, prostaglandins, mucosal blood flow. And number two, causes of imbalance that is H. pylori, destroy mucosa barrier, increase acid. Inhibit prostaglandins, reduce mucus or bicarbonates, acid from stress, smoking, alcohol, or Zollinger-Ellitzer syndrome.
Signs and symptoms: peptic ulcer is burning and stomach pain, empty stomach. Secondly, bloating and bleaching, a feeling of fullness of excessive gas. Third is nausea and heartburn. Fourth is discomfort similar to acid reflux. Vomiting blood is appear red or like a coffee grounds. Black or tarry stools is indicate possible bleeding. Diagnosis is a medical history and physically exam. Test for H. pylori, breath, stool or blood test. Endoscopy, camera scope into the stomach. Imaging like a upper GI serious X-ray. Thank you.
Treatment for peptic ulcer medication treatment. First, antibiotic for H. pylori infection. Example, amoxicillin, clarithromycin, and metronidazole. Second, acid suppression. Proton pump inhibitors (PPI) such as omeprazole and pantoprazole. H2 receptor blockers such as ranitidine and famotidine. For procedure and surgery, endoscopic treatment. For bleeding ulcer, endoscopic procedure may be performed to inject medication, apply clip, or use heat therapy to stop bleeding midline plus surgery. In rare cases, surgery may be necessary if the ulcer causes severe complications like perforation or uncontrolled bleeding. Surgical options include partial gastrectomy or vacuotomy. Mechanism of action of treatment peptic ulcer (MOA). Proton pump inhibitors (PPIs). Example, omeprazole, pantoprazole, esomeprazole. The MOA irreversibly inhibits the H+, K+, ATPase enzyme proton pump in gastric parietal cells, reducing gastric acid secretion. Number 2, H2 receptor antagonist. The example, ranitidine, withdrawn in many markets, famotidine. The MOA block histamine H2 receptor on parietal cells, decreasing acid production. And the number 3 is antibiotic for H. pylori. The example, clarithromycin, amoxicillin, metronidazole. And the MOA kill or inhibit H. pylori, the bacterium, causing mucosal damage and inflammation. Side effect of treatment: proton pump inhibitor, PPIs, antibiotic for H. pylori eradication, H2 receptor antagonist. First, headache, nausea, diarrhea or constipation, abdominal pain, and flatulence. For H2 receptor antagonist, the side effect is headache, dizziness, diarrhea, or constipation. And lastly, for antibiotic for H. pylori eradication, nausea, vomiting, diarrhea, altered taste, clarithromycin, fungal infection like oral thrush.